concerns with the COVID-19 vaccination program in a letter sent to Secretary of Health and Human Services. Reporter Karina Gary has more.
Governor Andrew Cuomo is calling on the Department of Health and Human Services Secretary Alex Azar and the federal government to aid states in their ongoing efforts to support underserved communities and protect undocumented immigrants under the COVID-19 vaccination program. Currently, the federal program does not provide funding to help states distribute the vaccine to Black, Brown, Asian, and low-income areas. It is anticipated that the vaccine distribution points will neglect these areas, the very areas that have been hit the hardest by the pandemic.
He's right to be concerned, and the federal government isn't giving the states enough money to make sure that they can have distribution of the vaccine in the communities that really need it.
Another concern is that the current program requires states to participate in a data sharing agreement, which would provide identification information that could be shared with federal agencies, like ICE. The fear of being exposed to the immigration agency will cause many undocumented immigrants to not get the vaccine.
You want everybody to get this vaccine. And, if you have a significant number of the population afraid that they're collecting data that's going to be used against them in some way, you're going to have people not being vaccinated. And that is completely opposite of what we're trying to achieve here. And again, in terms of public health, I see no point to gathering that specific information.
Currently, there are thought to be 866,000 undocumented immigrants living in New York alone, and many of them are essential workers. They handle your groceries, serve your food. The consequences of large groups of people like undocumented immigrants not receiving the vaccine are enormous.
And the way that these vaccines work best is by, making sure that as many people as possible are covered and protected. So when you have large populations that aren't vaccinated and protected to the same degree we like, you potentially expose not only those individuals to the disease, but also healthy individuals who, for whatever reason, haven't had the vaccine yet or can't get the vaccine.
Reporting from Utica, I'm Karina Gary, Eyewitness News.